Hi, my name is Lucas, and I'm autistic. Many of the problems facing my community stem not from autism itself, but from the belief that autism is a disease. This belief is known as the medical model of autism, which describes autism as a developmental disease characterized by deficits primarily in communication and social abilities. A deficit in empathy is often attributed to influencing autism. This is the theory of mind blindness. A medical model emphasizes the need for a cure. This belief permeates both the language surrounding autism and the treatment paradigm for it. The medical model is highly problematic. Many autistic traits are ingrained in the way autistic individuals experience and interact with the world around them, so curing autism would require fundamentally changing autistic individuals. Autism is better understood through the theory of neurodivergence, in which autism is part of a natural spectrum in human traits, like handedness or sexuality, and is defined by differences, not deficits. Challenges facing autistic people arise primarily as a result of interactions with society and non-autistic or allistic people, rather than being inherent to autism. Many challenges are caused by expectations based on abilities of allistic people, leading to autistic people being overburdened by expectations which are mismatched to their abilities. This theory is the social model of autism. These social challenges are contributed to by the double empathy problem, the theory that both autistic and allistic people have difficulty understanding each other. This theory is now even supported by the creator of the theory of mind blindness. The best solution to the many challenges facing autistic people is developing understanding and acceptance, not just of allistic people by autistic people, but also critically of autistic people by allistic people. It is far preferable to treat conflicts between autistic and allistic individuals, which are much worse for autistic people due to the power imbalance between the groups, rather than treating autism by erasing it. Autism shares some risk factors with conditions for which a medical model may be more applicable, such as intellectual disability or schizophrenia, so some individuals' difficulties may be best described by a medical model. The medical model for autism in general is wrong and can be very harmful. The effect of the medical model is clear within the language and symbolism surrounding autism and the treatment of it. Examples include Autism Awareness Month, which frames autism similarly to cancer or HIV, and the puzzle pieces, which directly imply that autism is a problem to be solved. Stigma related to the medical model is readily apparent within the anti-vaccine movement, as the myth of vaccines causing autism hinges not only on poor science, but also on an implicit value judgment that any risk of autism is not just bad, but worse than the risk of death due to preventable illness. The effect of the medical model on treatment is even worse. The most common form of treatment for autism, applied behavioral analysis, uses not just positive reinforcement, but also often punishments and restraints, for the sole goal of reducing autistic symptoms. Patients are punished just for being themselves, and are strongly promoted to engage in masking, which, when internalized, can lead to deep confusion over one's sense of self. The similarities between ABA and gay conversion therapy are striking, especially as the founder of ABA was a practitioner of gay conversion therapy. Homosexuality, as well, was pathologized until it was eventually accepted as normal. Women who refused to marry were considered hysterical for centuries, whereas female independence is now more accepted. The medical model of autism is a continuation of a long history of defining any who challenge social norms as ill, seeking to punish or erase them so as to maintain the status quo. It is paramount for the well-being of autistic people and of society as a whole to become more accepting of differences and to learn how to better understand and accommodate each other. We must stop trying to solve conflicts by erasing the people on the other side of it.